Hi everybody, Dr. Mandy here in Sioux Falls, South Dakota at Sioux Falls Audiology Associates. We are at our primary clinic today. We also have a satellite office at Lake Madison, which is about 45 minutes from here. So if you are new to this channel, why don't you go ahead and click the bell in the lower right hand corner and then click it again and you'll get alerts every time there's a new video. So I'm hopping on today to just kind of talk about some things that we hear around the office, and I always like to address those and just talk about them because a lot of times they are the same questions. So one of the questions or one of the comments that we hear quite a bit is, I have friends that spend thousands of dollars on their hearing aids, they never wear them and they're not happy about it. So why is that? Well, there are many factors that go into patients who are not satisfied with their hearing aids. And they're just to think about when you are sitting in a hearing aid consult. If you are a candidate for hearing aids and you're looking into all this stuff, it can be very confusing. It can be a lot of information. It can be very overwhelming, especially when you got family members who are doing the research and trying to understand hearing aids and what it all entails. So I'm just gonna go over some things that might frustrate a patient that has spent a lot of money on hearing aids. They've invested and they are just not getting out of them what they really need. One thing that does come up quite a bit is a hearing aid dispenser versus an audiologist. Some people kind of associate audiologists as more expensive, or I don't know, to just associate those two things. And in reality, if you do know some things about hearing aids and the industry, there are some franchises out there, very common ones that have been around for many years, that are actually more expensive than an audiology or an ear, nose, and throat clinic. And those people majority of them are not audiologists. So that perception is kind of false. So that's one thing to just kind of think of. So I always recommend that you see an audiologist, whether they have a master's degree in audiology or a doctorate degree in audiology. Most audiologists you're gonna find today are gonna have a doctorate degree. There's just more knowledge and there's just more of an understanding about hearing loss and programming hearing aids with the education that we have. So if you spent thousands of dollars on hearing aids and it was a hearing aid dispenser, granted there are some good dispensers out there, but if you really want to get to the medical side of correcting your hearing loss, you really should, I recommend you see an audiologist. Another one is the level of technology. It's really hard to understand what level of technology a patient needs or what's out there. So it's how active are you? If you are a very active person and you chose a level of technology that can't keep up with your lifestyle, of course you're gonna find yourself adjusting the hearing aids as you accommodate volume controls, programs that were added in the hearing aids just to keep up. And there's a lot of patients, they just don't want to monkey with their hearing aids and constantly adjust them just to accommodate. So that could be another reason why a patient's not satisfied. They just didn't get the right level of technology. Another reason is real ear measurements. I talk about this constantly, but real ear measurements, only about 30% of audiologists and dispensers are doing real ear measurements. And it's the gold standard of fitting hearing aids. It's getting the accurate prescription. It's making sure that every frequency there's hearing loss, you're getting the right amount of volume, because you can't just pump a whole bunch of volume in a hearing aid and call it good. That's like basically fitting somebody with an amplifier, and that's just not a great way to adjust or fit hearing aids at all. So real ear measurements, so you can see what you're doing. You're seeing in real time what that hearing aid is doing in your ears. So that's another huge issue why somebody might be dissatisfied with their hearing aids. Another thing that might be a factor is if the patient just wasn't ready for hearing aids from the get-go and they kind of felt forced by their families, and they have all these expectations that the hearing aids should just work right away. But everybody knows that hearing aids are a process. It takes a while for the brain to adapt. If you are not motivated or you're dissatisfied with the fact that you have to wear hearing aids, your satisfaction levels are going to be quite low. So it can take, a couple months, a couple weeks, up to a couple years to get used to hearing aids. It all depends on your motivation. It depends on how severe your hearing loss is and how long you're wearing your hearing aids. We recommend that you wear your hearing aids all waking hours of the day. Your brain has to hear all that stuff. And remember, it took you so many years to lose your hearing because it was such a gradual process. And then to correct it in an afternoon appointment, your brain needs time to remember. So there's just that factor to think about as well. So just some things to think about if you are doing hearing aid consults, just to remind yourself, you can't compare your experience or what experience you might be having in the future to somebody else's experience, because there's just so many factors that go into why a patient is not satisfied with their hearing aids. I know another thing is being underprescribed. Maybe the person that recommended the hearing aid underprescribed the patient. They fit them with something they should have probably never been fit with. Again, another factor to think about. So when you're doing your research on who you want to help you, go on your hearing loss journey to really correct it the way it's supposed to be, do your research. And I hope this video was helpful. If you have any questions or you just want to make an appointment and talk more about some of the stuff that we've been talking about, please call our office. We have our Lake Madison office, which is 45 minutes away, and we also have our Sioux Falls location. Our number is 605-306-3050. Thanks, have a great day.
We are here to help. If you want to chat with Dr. Mandy, go to Sioux Falls Audiology Associates.com.